And welcome back. Well, we all know someone who appeared to be in excellent health, who was way too young to have a heart attack or stroke. Our next guest was one of those people. At 39, Katherine Wilemon had a heart attack caused by a complete artery blockage. She is now the CEO of the Family Heart Foundation, and she joins us along with Dr. Seth Baum, and they are here to tell us about an important genetic condition that affects 1 in 5 people. Good morning to both of you.
Good morning.
Good morning.
Thank you for joining us. I do, Katherine, think that so many people know someone who appeared to be in great shape. You were 39 years old. Tell us a little bit about your story and what happened to you.
Absolutely. So I was out gardening when I had my heart attack, and I was fit and I was young, and I actually had a hard time getting the paramedics who arrived to take me seriously. What I later discovered, though, was that I had inherited risk factors for cardiovascular disease, and one of them is elevated lipoprotein (a). It's a very common condition. About 20% of the American public has inherited it as well. That's about 60 million Americans, but what we know from research is that only 1% in the last 10 years have been screened. So it goes highly undetected.
I have not heard of it before. I think a lot of people are thinking, is she talking about LDL and HDL, but you're not. This is totally different. So Dr. Baum, so what is elevated Lp(a)?
Yeah, so Lp(a) is like a really bad LDL particle, and Lp(a) does 3 things that make it particularly dangerous. It causes plaque formation in the arteries that feed the heart and the brain and other parts of the body. It causes increase in inflammation, and it causes clotting. So these 3 things can conspire to cause a stroke or a heart attack like Katherine experienced at just 39 years old. It's an inherited disorder. It's highly prevalent, as you just heard. Fewer than 1% of people know their Lp(a) levels. It's important to check it.
So who should get tested then? Is this something just everyone should kind of say, hey, I want to get a baseline?
Yes, everybody should get checked. I'm a preventive cardiologist, and I believe everybody should know his or her Lp(a) level. The Canadians, the Europeans have it in their guidelines. We should have it in ours. Knowing it will help inform us on how to treat our other cardiovascular risks, such as LDL, which we can then much more effectively and aggressively reduce if we know our Lp(a) risk.
I love that. And doctor, I just want to stay on you for a second, because I do think a lot of people are aware of their HDL, LDL, and they think, okay, well, these are, for those things, they're cholesterol factors. Is Lp(a) related to cholesterol itself, or is it a totally different thing? Like, can you change this or alter it with food and diet?
So Lp(a) is related to cholesterol. It is really like a small LDL particle, but it is not changed with diet and food and exercise. It's fully based on your inheritance, and we really can't change it otherwise. I just want to know one thing about LDL, though. It is true that a lot of people know their LDL. You'd be shocked at how poorly we're reducing LDL in the United States. We have a public health crisis where we have to do it more to reduce the risk of the #1 cause of death and disease in the United States, which is cardiovascular.
I fully agree with that, because a lot of times we get our numbers and it's kind of like, oh, you're borderline, or oh, you're fine, but we don't really do anything about it. So I think that's extremely important, and that's a very valid point. Katherine, I want to go back to you, because I know you've dedicated your life after this to raising awareness with the Family Heart organization. So talk a little bit about what you guys do and how you're creating awareness and what you want people to know as we leave them today.
So we work with health systems and policymakers to put in place more systematic screening for all causes of inherited cardiovascular disease. But March is kind of a special month, because March 24th is Lp(a) Awareness Day, and we have tens of millions of people around the world who join us. So we really appreciate this opportunity to speak with your audience, because it is an opportunity for prevention to understand your genetic risk. It is simple. It just requires a blood test. And as Dr. Baum said, there's a lot you can do today, and therapies are on the horizon very soon, so there'll be even more that people can do.
Wonderful. Dr. Baum and Katherine, thank you so much for joining us today.
Thank you.
Thank you.
For more information, you can go to familyheart.org. Stay tuned. We're going to have our picture of the day right after